Hello, everyone. Welcome to the session on research and policies on the horizon. My name is Richard Knight, and I will serve as moderator for this exciting session. During this session, we will discuss 4 or 5 topics that are very current and relevant to the kidney patient community. Well, we're going to talk on the topic of community policy, a united effort to create and enhance the National Living Donor Assistance Center to increase kidney transplantation. This is an exciting program, and to speak on the topic is a longtime friend of mine, Miss Kim Gifford, who I've known since she was the executive director of ASTS. Now she is serving as the program manager for the National Living Donor Assistance Center, the American Society of Transplant Surgeons. Kim, the floor is yours.
Hello, my name is Kim Gifford, and it's an honor to be here with you today to speak about the National Living Donor Assistance Center and how the community has contributed to the development and enhancement of the program. When we speak about the National Living Donor Assistance Center, we use the acronym NLDAC. Today, NLDAC exists as a national program that reimburses non-medical expenses associated with living organ donation. While medical costs are generally covered by the recipient's insurance, we know that travel expenses, lost wages, and dependent care are often not covered, and these expenses can represent significant barriers for many people interested in living organ donation. The mission of NLDAC is to reduce financial disincentives to living organ donation. The program is funded through a collaborative agreement with HRSA, the Health Resources and Services Administration. Our team has been administering the grant since its inception in 2007. When we initially launched, we focused solely on the reimbursement of travel expenses. Over the past year, based on some exciting regulatory changes, we were able to add lost wage and dependent care reimbursement to the portfolio of allowable expenses through the NLDAC program. Here you can see the logos of the organizations that work collaboratively on the NLDAC program. We work closely with our colleagues across the country and very collaboratively with HRSA to fulfill the goals of the program. NLDAC also uses an advisory group as a mechanism to have ongoing feedback from the community. The advisory group has representatives from all the organizations that you see listed here, and we meet several times a year to report outcomes, to seek community input, and to maintain a focus on continued improvement of the program. So I wanted to start with this brief overview of NLDAC so you would be familiar with the program, but now I'm going to take a step back and talk about how the community helped develop this important program. There are 2 key pieces of legislation that set the groundwork for NLDAC. The first is the National Organ Transplant Act, which is known as NOTA, that was passed into law in 1994. 20 years later, the Organ Donation and Recovery Improvement Act, known as ODRIA, was the second piece of critical legislation. Both of these were bipartisan bills supported by the broad community, including advocates from AAKP. NOTA was important because it established the national systems that guide transplantation today. It established the Organ Procurement and Transplantation Network, the Scientific Registry of Transplant Recipients, and the Division of Transplantation as the administrative arm to oversee transplant activities. NOTA also prohibited the buying and selling of organs and provides for monetary fines and/or imprisonment for these cases. But even in the bill, from the very beginning, it clarified that reimbursement of travel expenses and lost wages is allowable and did not violate the law. ODRIA was passed in 2004, and it included a variety of initiatives designed to increase organ donation and to help more people on the waiting list get a transplant. Important to our discussions today was the inclusion of language in ODRIA that allowed the use of federal dollars to reimburse living donors' travel expenses and other non-medical expenses as authorized by the HHS Secretary. Federal reimbursement was deemed allowable except in the 3 cases that you see listed here: if an insurance company, a state program, or the recipient of the organ can cover the expense. This last bullet is important because it brings an element of means testing to the program that is necessary in order to comply with the law. So despite the depiction in Schoolhouse Rock that becoming a law is the end of the journey, I would argue that in many cases it's just the beginning, because once the law is passed, there has to be regulation developed to support the law. This was definitely the case for NLDAC, and our regulatory process took place through HRSA and the federal rulemaking process. For those of you who are less familiar with the federal rulemaking process, I'd like to share a brief, albeit a complete outsider's view of this process. The President may direct an agency to take action, as happened with the Advancing American Kidney Health Initiative. We saw this in 2019. There also are times when Congress can direct an agency to take action, as happened when ODRIA was passed in 2004. An agency can also initiate the federal rulemaking process as long as their work falls within their scope of authority. And all agencies that develop regulation must follow an open process that includes the opportunity for public comment. So public comment is an important part of the federal rulemaking process, and anyone can submit comments on a proposed rule. It's important to know that this is not a numbers game, and the outcome is not decided by the number of people who comment for or against a proposal. However, it is an important opportunity to be able to submit data, to submit expert opinions, and other facts that can help the agency finalize regulation. And while it can seem like a daunting process, your voice can and often does impact a final rule. So how do you learn about this rulemaking process and the opportunity to submit comment? Well, the Federal Register is the official publication of the government, and it's where they publish rules, proposed rules, notices, executive orders, and other presidential documents. It's published every weekday except for federal holidays, and I've listed the website here if you'd like to learn more about the Federal Register. It is a vast repository of information. It is not easy reading, but they have some tools that help you set up alerts if there's a particular topic that's of interest to you and that you would like to follow in the Federal Register. So at this point, if you're saying to yourself, what does the Federal Register have to do with NLDAC? We're going to take a look at the next slide to see how the Federal Register and NLDAC have intersected over the years. Since 2005, there have been 12 publications in the Federal Register related to the NLDAC program. It started in 2005 after ODRIA was passed into law, when HRSA sought feedback on the program that they used to develop their request for proposals. Subsequent to that, a proposal went out. Our team was awarded the initial collaborative grant. We convened the advisory group, and in April of 2007, there was a request for public comment on the eligibility and qualifying expenses for NLDAC based on the recommendations that came from our team and the advisory group. So in the early days, this proposed rule solicited about 29 comments, and interestingly, the government had thought about finalizing one income threshold, but based on the community comments, they ended up finalizing an income threshold that was higher. Again, more proof that your voice does have an impact in this process. And over the next 2 years, we had minor adjustments to the eligibility for NLDAC. And as you can see, in 2008 and 2009, there weren't very significant changes, and the public comment was pretty minimal. As we moved into 2010, HRSA sought feedback on expanding qualifying expenses as was allowed in the initial law. Then you see we have this gap, and things were pretty quiet on the Federal Register front in regards to NLDAC until the executive order on advancing American kidney health was announced in 2019. As I'm sure many of you know, this set in motion positive initiatives in kidney care and in transplantation, including renewed talk of expanding NLDAC. In late 2019, HRSA asked for feedback from the public on adding lost wages and dependent care to the portfolio of allowable expenses. And then in March, they sought public comment on changes to the program eligibility. The proposed rule on lost wages and dependent care received over 267 comments. The request for public comment on changes to eligibility received 77 comments. And a final rule was then released in September of 2020. These two most recent Federal Register activities generated over 340 public comments that helped shape the final rule and the final notice, which led to some wonderful expansion in the NLDAC program. So thanks to the public comments and the receptiveness of HRSA, these changes were implemented to the program. Input from organizations such as AAKP and others resulted in the addition of lost wages and dependent care reimbursement added to the portfolio of the already existing travel reimbursement program. As I mentioned early on, the law is a component around means testing. It had been set at 300% of HHS poverty guidelines and was increased to 350%, which should capture about 67% of US households. The other addition that came out of this rulemaking process was that anonymous, non-directed donors can apply without an identified recipient. This is a much easier pathway for non-directed donors to have access to NLDAC funds. We are very grateful for the community involvement in these important changes. And if you or you know somebody who is considering living organ donation, I hope that you will check out the program and apply for NLDAC resources if you're eligible. In the big workings of federal government, I know that we are a small program. However, we're very proud of the work that we do to support living organ donors and their recipients. Here is a snapshot of NLDAC's impact since the program's inception. We have had over 11,000 approved applicants. Over half of our applicants go on to complete surgery. So you can see over 6,000 surgeries have been facilitated through NLDAC funding. We have distributed over $21 million in reimbursement for travel, lost wages, independent care expenses incurred by these living donors. And most gratifying is that 75% of donors report that NLDAC funding helped their ability to donate. So that is over 4,500 incremental donors added to the system since 2007. That's 4,500 lives saved by donors that received what in the big picture is pretty modest funding through this federally supported program. That funding allowed them to pursue their desire to be a living organ donor. We know that this money saves the we know that this program ultimately saves the government money. We published a paper in Clinical Transplantation in 2018 that estimated government savings in dialysis costs from incremental transplants facilitated through NLDAC was over $256 million. I think that's a great return on investment compared to the total NLDAC costs. And if you're interested in learning more about the ROI on the NLDAC program, the paper is available via open access on Clinical Transplant's website, and I'll encourage you to check it out. So as I have said throughout this presentation, NLDAC support is made possible because of HRSA's strong commitment to living donors and their receptiveness to the community's input that helped develop and launch this program. If you want to learn more about the NLDAC program, I encourage you to follow us on social media, visit our website, and leverage free resources that we've made available. In closing, I hope that this presentation encourages you to take part in future rulemaking, whether it's on issues around NLDAC, transplant, kidney care, or whatever that you feel passionate about. And if we can be of any service to you, please feel free to contact our office and learn more about NLDAC. Thank you to the organizers of this meeting and to AAKP for this opportunity to join you today.
Thank you, Kim. That was a fine presentation. We appreciate your leadership in this area. This program provides great assistance to patients who are in need and is another way for them to have support in pursuing a kidney transplant.